Okay, so with a lot of intention, our two speakers have worked together, and we thought that might be a nice way to see the progression of research projects. So our next speaker is Dr. Lenka Shriver. She's a professor in the Department of Nutrition, also at the University of North Carolina at Greensboro. Her research focuses on understanding associations between parental food-related behaviors, family environment, and risk among children and adolescents. She has an extensive interdisciplinary experience in childhood obesity research through collaborations with experts from the field of developmental psychology, child development, family sciences, and kinesiology. Currently, she's collaborating with Dr. Lierkes, Weidman, and Bueller on a large longitudinal study titled Biopsychosocial Predictors of Obesity During the First 2 Years of Life. This is an NIH-funded study. And with that, I will turn it over to Dr. Shriver. Thank you.
Thank you very much. And I will try to share my slides. Give me a second, please, and let me know what you're seeing. And hopefully you're seeing my big slide. Yes, okay, that was huge success today. Well, hi everyone. My name is Lenka Shriver, and thank you for the introduction, Rachel. I'm really excited to be here. I had a chance to watch the first Veggie Meter Forum online, the recorded version. So I'm really excited to be one of the presenters. And I am a proud colleague of a proud owner of the Veggie Meter device. So that's some of the findings I will share with you today is thanks to Jared and him allowing us to use the Veggie Meter in the iGrow study that I will talk about today. So just a little bit to give you an idea about what I have been focusing on in my research. I do focus on psychosocial correlates of dietary outcomes and obesity risk in children of all ages, pretty much. I started my career looking at elementary school age children and primarily focusing on parental behaviors and parenting styles as they relate to food intake and obesity risk. And I have been involved heavily in interdisciplinary research. So I work with parenting specialists and child developmentalists and on my research. But my focus has been on parental behaviors, and fruit and vegetable consumption is obviously very, very important for children. It's one of the key indicators of nutrient-dense diet and healthy eating. And so that has been a primary focus in several of my studies, especially with families with young children and of preschool age. And I have been studying maternal behaviors, actual consumption of fruits and vegetables of moms, because that is really strongly associated with what the children consume themselves. And it really starts with taste preferences of the moms and what they're willing to buy and how they serve fruits and vegetables to their children. And so I have kind of have a background on that. But also in the last several years, we have been learning more and more about not just the behavioral influences of parents, but also the broader environment. I focus primarily on the family and parenting environment, but with Jared's expertise, we can now look at the broader environment in the neighborhood and in the community. But we know there are also genetic influences on food and vegetable consumption. So there is more recent research looking at the influences of maternal diet during pregnancy and during breastfeeding, and how that influences children's acceptance of fruits and vegetables. But most of this previous research really has relied on self-reported measures of fruit and vegetable intake. And so, including my research, I have always used food frequencies, food records, and dietary recalls. And as Jared pointed out, and many of us, I'm sure, have experiences with that, it has a lot of challenges and limitations. Now, I have additional limitation working with large interdisciplinary teams. There is oftentimes not time to even administer self-reported measures. So nobody wants to really do recalls. We don't have enough resources. We don't have enough funding. So all of that, I'm hoping that the Veggie Meter will actually make my life easier, because now we can use that as one of the more objective measures of fruit and vegetable status. And so I was very excited when Jared was willing to work with us to let us use the Veggie Meter to assess maternal intake of fruits and vegetables during pregnancy. And so we still use the self-reported measures of fruit and vegetable intake, but we were able to use the skin-based spectroscopy and use the Veggie meter in our ongoing study. And when I kind of dove deeper into the literature, it was pretty clear that while Veggie meter was validated against the gold standard of the the carotenoid status, the serum and plasma carotenoids, it has been validated in some studies against self-reported intakes, but most of those studies were done in adults in white samples, not very diverse samples, and only, in fact, about 6 studies looked at diverse samples that included minorities or had more than 20% of the population represented from minorities and non-white populations. So, and I did not find, to our knowledge, I did not find a study that would look at skin carotenoid levels and self-reported intakes in pregnant moms. And that is the ongoing study we have right now at UNCG. So the 2 objectives of our study was to look at associations between the self-reported fruit and vegetable intakes and the objective measure of fruits and vegetables among pregnant women. And the second aim was to start exploring some potential differences by selected sociodemographics, pre-pregnancy weight status, and also factors like food security status in our sample. So just to give you an idea a little bit about the iGrow study, that is a NIH funded R01 that's still ongoing. We started in 2018. It's the Infant Growth and Development Study, but we call it the iGrow. And we had 2 big aims in this study, but I want to point out that the data I'm sharing with you today is coming from the first aim that's focusing on the outcome, which is weight gain from birth to 6 months of age. So the study is all focused on biopsychosocial perspective to look at early origins of childhood obesity development. And we're not considering just the child, just the infant from birth, but we're also looking at the mother and the psychobiological risk that might be the origin of the childhood obesity development. But we're also looking at the family risks and the broader environment. So I originally planned to do dietary assessment of the pregnant moms in our sample, but with the opportunity to use the Veggie meter, then we added that to our data collection, and we were able to actually collect data with the Veggie meter in our pregnant sample. So the longitudinal design includes actually 5 total visits of moms starting in pregnancy. Our recruitment goal was 300. I am happy to report that we achieved our goal -1, and we were trying to get 300, but we ended up with 299 moms, which, given the COVID pandemic, we're all very happy about, and we had a big party to complete our recruitment. We're still collecting data because the data collection goes through age of 2 of the children, but we do have data now collected from all the pregnant moms. Today, I can only share data from cohort 1. As you can imagine, COVID really put brakes on our data collection and recruitment for several months. We were actually shut down for almost 4 months. And we were the first study to reopen data collection and recruitment in 2021, but it has been pretty rough. So I am happy that we have all this data from our participants. We recruited in Greensboro area in Guilford County. And we were recruiting in a variety of different ways, but our most effective way was in-person recruitment, and that was in birth classes and WIC clinics, public health departments, and obviously that was also shut down during COVID. So we did have significant challenges with that, but we were able to recruit and continue recruiting, and we had moms who were 18 years and older, fluent in English, expecting a singleton, and we also were recruiting women who were planning to stay in the region because we needed them to complete all 5 visits. Now, the data that I'm sharing today is coming from the prenatal visit only, for which participants receive $50, but the total study was actually incentive of over $400 for participating because it was such a huge interdisciplinary study and we were collecting a lot of different data. Now, in terms of the study measures for this current study, we collected a lot of the information you can imagine from all different kind of parts of the biopsychosocial risk perspective, but the Qualtrics they completed before the prenatal visit included all the socio-demographics, but we also focused specifically on assessing food security status. We also had a chance to assess the perceived availability of healthy foods in the neighborhood. I know that's not what Jared views as an ideal measure of food environment, and that's why we're so happy to partner with him and do some of the geocoding and GIS study with agrodata in the future. But this was just a 4-item subscale on perceived availability of healthy foods. And then we also got to measure the maternal height and weight during the prenatal visits, and we relied on self-reported measures of weight before pregnancy, so we can assess mom's weight status prior to pregnancy and also look at gestational weight gain during the study. Now, in terms of the skin carotenoid levels, we used the same device, Jared's device, the Veggie meter that came out after 2017. So I listened to some of the discussion in the first Veggie meter forum. And so I was happy to find out that this device actually corrects for the individual melanin concentrations. So we used this in 3 repeated measurements, and we took the mean value of 3 measurements unless there was a problem during one of the measures. So we took notes about, long nails, artificial nails, or any kind of malfunction that could have been possible during the measurements. And the range of scores for this device was 0 to 800. Now, for the self-reported fruit and vegetable intake, we used the same screener as Jared did in his study, the fruit and vegetable screener from NCI, but we also had dietary screener questionnaire, which kind of measures a little broader quality of the diet, but it does include total fruit and vegetable subscale, and you can also look at total vegetable intake and fruit intake. Now, the vegetable intake we actually look at the one that includes legumes but excludes French fries, and we used a similar subscale from the fruit and vegetable screener. So both screeners were estimating the intakes in cup equivalent, so we can look at that for the whole sample. And I can share more details if you have any questions about this later. For stats, this was looking at the data from cohort 1, so total of 176 moms provided some kind of data during the prenatal visits or the Qualtrics surveys, but we were just starting to explore the data, and we're hoping to look at these analyses in the full sample. So I just want to give you a heads up that more analyses will be coming soon, but bivariate correlations to look at the associations between the Veggie meter and self-reported intakes, and then we use ANOVAs and chi-squares to explore our sample and look at potential differences by the selected variables. So some of the results I want to share with you. Well, first of all, I want to point out that we were very fortunate to have a sample that was very diverse across multiple indicators. Now, on average, our moms were about 29 years old, but based on pre-pregnancy BMI, the average BMI was in the overweight category. In terms of the race and ethnicity, we had 3 kind of racial ethnic groups represented in our sample, but I want to point out that 1/3 of our sample identified as Black or African American, and almost 22% identified as other, multiracial, biracial, or Hispanic. So we did have a very diverse sample in this study. We also had nice variance in educational attainment and income. We had 1/4 of our sample with postgraduate work or postgraduate degree, but we also had 22% with high school diploma or less. And then in terms of income, we had 35% below 25,000 per year for the household income, but we also had 20% above 100,000 per year. So again, a large variance in our sample. Now, 30% of our sample classified as food insecure based on the short 6-item food security module from USDA. So we had a lot of families who were experiencing food insecurity.